Hey, it's Dr. Swaney again from the Coleman Institute. Today I'm going to talk a little bit about the difference between addiction and dependence. We get this question a lot. And is dependence addiction? Does addiction have to have dependence? So it's confusing. I'm going to try to make it pretty simple here. Sometimes I'm good at that, sometimes I'm terrible. But let's think about it this way. When you hear people in the press or in the internet talk about addiction, a lot of folks will use it in the setting of dependence. And so I can give you this example. Cancer patients. Anytime I was a practicing medical oncologist for a while, and when I would start folks on pain medicine for whatever cancer they had, they would say, wait, I don't want to take this because I don't want to become addicted. And I got that question all the time. People said that all the time when they would start a opiate prescription, and had to do a little bit of education there. No, I think what you're saying is you don't want to become dependent, meaning that you don't want to take them so much that you have to have them or you go through a withdrawal period. Yeah, that's exactly what I'm talking about. So there's misunderstanding between what's addiction and what's dependence. You don't have to have dependence to have an addiction. You don't have to have dependence to have a substance use disorder. And so what I'm going to say from here on is substance use disorder instead of addiction. Okay. Most people who have substance use disorder, the majority, do have dependence as part of their substance use disorder. But we do see people who don't have dependence who still have raging addictions, raging substance use disorders. The example of that would be a person who is a binge drinker. Once they start drinking, they drink, black out, and they do it every weekend or something like that. Or the person who only uses crystal meth a couple of times a month, but when they do, they just blast it, go through, to the wall. So those, that would be people who don't have a dependence, who do have substance use disorders. And people can be dependent without having a substance use disorder. So I'm going to make a simple little analogy here. It may make sense, it may not. But think about this like caffeine, right? A lot of us drink caffeine. A lot of us drink a lot of caffeine. And a lot of us drink caffeine so much that if we don't drink caffeine, we go through a little bit of a withdrawal, right? Get a little bit of a headache. I'm kind of cranky, this, that, or the other if I don't get my caffeine in the morning. So that is dependence. Okay, so there's a lot of us out there that are dependent on caffeine. If we don't get it, we go through that withdrawal period. And so let's say Diet Coke. All right, so I drink 3 Diet Cokes a day, and if I don't drink them, I get a headache. That's dependence. Well, when do you drink your Diet Coke? Well, I drink one for breakfast, one for lunch, and then I have one in the afternoon. Okay, every day? Yep. Why do you drink it? Well, I like the taste of it, and when I'm thirsty and need a drink, I drink it. Okay, that's fine. The person still has dependence. There's nothing wrong, so to speak, with why they're, drinking Diet Coke or how often they're drinking Diet Coke or whatever. Now you got another person who comes in and says, yeah, I love Diet Coke. Drink a case of it a day, every hour. I'll knock it down. Okay, that's a lot of Diet Coke. Why are you drinking so much of it? Well, it just relaxes me. And, if I don't have one in my hand, I just don't feel right. It helps me with my anxiety, helps with this, that, and other, blah, 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 blah. Okay. Well, is that drinking that much Diet Coke, is that bothering you, sir? Well, my wife doesn't like it because, I'm spending a lot of money, but I like the this specific type of Diet Coke, and I have to get this from the store. I'm stocking up on it, and, money's been an issue, but, we get through it. All right, so clearly, those are 2 different examples. That's a person who's drinking Diet Coke 3 times a day, has a dependence, but it's not causing any problems. Drinking it for normal reasons, so to speak. They're thirsty. They like the taste of it. Okay. Then you got this other person who's knocking down a case of it every day, and that's an extreme example, don't get me wrong. But I used it to illustrate that it's not about dependence. It's about, how are you taking it? Why are you taking it? Is it causing problems? All that mixes in to make up a substance use disorder. Dependence is just dependence. Dependence doesn't mean anything other than if you don't take whatever it is, you go through a withdrawal period. That's all it means. Doesn't mean there's a problem. Means that there could be a problem, that's for sure, but it's not required to have a substance use disorder. Okay, so I know that's confusing. I hope that example helped a little. If it didn't, write us back, let us know. I'll do everything I can to answer your questions. Hope you guys have a good Thanksgiving. That's it.